If I told you that thousands of seniors lose their Medicare benefits every single day without even realizing it, would you believe me? Most people don't. But the truth is, Medicare scammers are getting smarter, faster, and more sophisticated than ever before, and the people they target most are older adults who trust too easily, answer their phones politely, or just want help understanding complicated benefits. Today, I want you to stay with me all the way to the end, because what I'm about to tell you could protect your identity, your money, and even your future healthcare. Small mistakes lead to big losses, and I'm going to show you exactly how to protect yourself before it's too late. My name is the Medicare Mentor, and I speak to seniors just like you every single day. Most tell me the same thing. The calls won't stop. The letters won't stop. The offers sound too good to be true. They're overwhelmed, confused, and unsure what's real and what's a trap. And many times, by the time they reach out for help, the damage has already been done. A stranger used their Medicare number. Claims were filed in their name. Benefits were switched without permission. And sometimes the senior never even knew until months later. I want you to imagine something for a moment. Picture waking up one morning, calling your doctor to schedule a visit, and the receptionist tells you your plan was changed. You didn't change it. You didn't authorize anything, and suddenly you're responsible for hundreds of dollars in out-of-pocket costs. It happens every single day. This is exactly why you need to understand how these scams work, what scammers look for, and what warning signs you must never ignore. Most scams start the same way. A phone call. A calm, friendly voice claiming to be from Medicare, Social Security, your insurance company, or even your doctor's office. They'll say your benefits are being updated, or your card is expired, or the system shows an error. They may call you by your full name. They may already know your address. Sometimes they can even sound like a real professional. But let me make something absolutely clear. Medicare will never call you and ask you for your Medicare number. They will never ask you to verify personal details over the phone. They will never pressure you or say your benefits will be cut off if you don't respond immediately. Anyone doing this is lying to you. I talked to a woman recently, 74 years old, who received a call saying she qualified for a free genetic cancer screening. The caller said Medicare was covering it fully and all they needed was her Medicare number. She thought she was doing the right thing, protecting her health. What she didn't know was that scammers used her number to bill Medicare over $8,000 for tests she never took. That money is gone. Medicare paid it, and she didn't even know until she received a notice several months later. It took her hours of phone calls and months of stress to clean up the mess. If she had ignored that call, her information would have stayed safe. Another scam that is exploding across the country involves signing people up for plans without their permission. It often starts with someone saying they can save you money. They promise extra benefits like dental, vision, hearing, transport, meal services, flex cards, or even grocery allowances. Now, many legitimate plans offer those benefits, but scammers use those same talking points to lure you into giving away your Medicare number. All they need is the number. Once they have it, they can switch your plan without you knowing. And because Medicare only allows one active plan at a time, your old coverage disappears instantly. That's how people lose access to their doctors overnight. There is also a very dangerous scam where someone calls and says your Medicare card is being replaced with a new plastic chip card. They say your current card will stop working unless you verify your identity. Again, this is false. Medicare is not replacing cards, not issuing chip cards, and not calling anyone to confirm anything. Yet seniors fall for this constantly because the call sounds official. Some callers even use fake caller ID so it appears as Medicare or CMS. Remember, Medicare doesn't call you like that. Let me tell you what scammers are really after. They don't want your money today. They want your Medicare number. Your Medicare number is worth more than your Social Security number on the black market. Because it can be used repeatedly, once a scammer gets your number, they can sell it, trade it, or use it to bill Medicare for equipment, services, or treatments you never received. Knee braces, back braces, diabetic supplies, lab tests, home health visits, ambulance rides, you name it. All charged under your identity. You may never see the charges directly because Medicare pays the bill, but it can impact your ability to get services later. Now, if you're thinking this sounds complicated, stay with me. I promise you, by the end of this video, you will know exactly how to protect yourself. You are not powerless. You are not alone. And you can outsmart these scammers every single time if you follow the right steps. Before we go deeper, if you find this information helpful and you want more videos that protect your Medicare, save you money, and help you understand your benefits clearly, make sure you subscribe to Medicare Mentor. It takes 1 second and it helps you stay ahead of the scams targeting seniors every day. Now let's continue because the next part is extremely important. Scammers work fast. They use fear, pressure, and confusion as tools. If someone calls and says your benefits are at risk, they want you to panic. If they offer you something free, they want you to get excited. They rely on emotion because emotion makes people act quickly without thinking. That's exactly what you must avoid. Anytime someone calls you asking for information, stop. Take a breath. Slow the conversation down. A scammer will try to keep talking fast. A legitimate representative will allow you time to think, time to question, and time to verify. You should also know that scammers don't only call. They send letters. They send text messages. They send emails. Some even send fake medical equipment to your home, hoping you won't question it. If you receive a brace or device you didn't request, call your doctor immediately and report it. Do not use it. Do not sign anything. That device is often a sign that your Medicare number has already been stolen and is being used to file fraudulent claims. Another method scammers use involves door-to-door visits. Someone might knock and say they're from Medicare, or your plan, or a health agency. They'll say they're offering a free checkup or wellness exam. Never let a stranger into your home. Medicare does not send people door-to-door. Your plan will not send someone without scheduling it officially. Always call your plan using the number on your card to verify anything before agreeing to it. Here's what many seniors don't realize. Fraud doesn't just cost the government money. Fraud affects you personally. It can limit your ability to change plans. It can complicate your medical records. It can interfere with your legitimate claims. Worst of all, it can cause delays in real treatment when you actually need help. Imagine needing a test and being denied because Medicare thinks you already had the same test last month, all because a scammer billed it using your number. These things happen every single day. But I want to shift the energy now because the goal is not to scare you. The goal is to empower you. You are not a helpless target. You can protect yourself with simple habits and a little awareness. Never give your Medicare number over the phone. Never confirm your address or date of birth unless you personally place the call. Never feel pressured to make a decision on the spot. If someone claims you must act immediately, that is your cue to hang up. If something sounds too good to be true, trust your instincts. Real offers don't require instant decisions. I want you to remember something simple but powerful. Your Medicare number is the key to your healthcare identity. Protect it the same way you protect your bank information. You don't give your ATM PIN to a stranger, so don't give your Medicare number either. And if you ever receive a call and you're unsure whether it's real or not, here's what to do. Politely tell the caller you will call back. Then hang up. Look at the number on the back of your Medicare card or your plan's member services line. Call them yourself. If the caller was real, they'll know exactly what you're talking about. If they were a scammer, you just protected yourself. One last thing before we wrap up. You should check your Medicare statements regularly. Review your explanation of benefits. Look for anything you don't recognize. If you see a charge for a test, treatment, or device you didn't receive, report it immediately. The sooner you act, the easier it is to stop the fraud. Before we end this video, I want to thank you for staying with me. Every senior deserves honest information. Every senior deserves protection, and every senior deserves peace of mind. That's why this channel exists. If you want clear, trustworthy guidance on your Medicare, if you want to avoid scams, save money, and understand your benefits without the confusion, subscribe to Medicare Mentor and stay informed. Your Medicare is your lifeline. You have the power to protect it. Stay aware, stay cautious, and stay connected. I'm here to help you every step of the way.